A very good morning to all of you. So today I just discuss topic anti-cancer drug. Anti-cancer drug is important for the PG students only, and this is not asked separately as a short note or any separate question. But in 3 or 4 university exam before that, it is included in the LAQ. Like question was asked that what is cancer and what is the molecular basis of cancer, and then there is a enumerate anti-cancer drug. Alright, so question was asked like that, and this question has been asked previously at least 3 or 4 university exam. So if question is asked previously, that means you cannot escape in your university exam of MD. So let's discuss. You can just simply know what are the anti-cancer drug and what is their mechanism of action. Not very detailed because it's a detailed part is on in pharmacology. So in our biochemistry, you just know the name of drug, and in simpler form what is their mechanism of action. That's it. Okay, because it is asked only in 4 or 5 marks question, so don't go through in a very detailed way. Okay, so let's start. What are the anti-cancer drugs? So first is that of your anti-metabolites. Anti-metabolites. So first category is what? Your anti-metabolites. Okay, so anti-metabolites include, first drug is your 5-fluorouracil. First is that of 5-fluorouracil, or you can write 5-FU. Okay. First anti-metabolite drug is your 5-fluorouracil. 5-fluorouracil is your inhibitor of what? Inhibitor of your enzyme thymidylate synthase. Okay. This question is important for your MCQ. Okay, that 5-fluorouracil, this question has been asked 4 to 5 university exam before. In that exam where MCQs are included, that 5-fluorouracil is the inhibitor of which, so that many options were there. That answer is that of 5-fluorouracil is inhibitor of your thymidylate synthase. Okay, thymidylate synthase is while this enzyme is using while there is synthesis of your while you just undergo through the pyrimidine metabolism, there you will just study this thymidylate synthase enzyme. So okay, so at that step 5-fluorouracil inhibit. So at that, because pyrimidine synthesis ultimately inhibit, so there is a no further application. That's why it acts as your anti-cancer drug. Okay, second anti-metabolite is that of your methotrexate. Okay, methotrexate, very important drug. Many times question has been asked. Methotrexate is a inhibitor of what? It inhibits your dihydrofolate reductase enzyme. So methotrexate is inhibitor of your dihydrofolate reductase. So very important MCQ. Okay, so inhibitor of 5-fluorouracil and methotrexate inhibit which? Both these you have to remember, and this also you have to remember, methotrexate and 5-fluorouracil for your viva also, because it is a question of your grand viva also. Okay, next your third one is your that of purine analogs. Purine analogs. So various purine analogs act as your anti-cancer drug, like your 6-mercaptopurine. 6-mercaptopurine, 6-thioguanine. Okay, 6-mercaptopurine, 6-thioguanine act as your anti-cancer drug, and these are your purine analogs. Fourth one is your pyrimidine analog. Pyrimidine analog. So in pyrimidine analog, the drug which is used as an anti-cancer is your cytarabine. cytarabine. Okay, so first classification of your anti-cancer drug is your anti-metabolites. What drugs it includes? Anti-metabolites is first drug is your 5-fluorouracil. 5-fluorouracil inhibit your thymidylate synthase enzyme. Second is your methotrexate. It inhibit your enzyme dihydrofolate reductase. Then your purine analogs like your 6-mercaptopurine and 6-thioguanine, and then your pyrimidine analog, that is your cytarabine. Okay. So first classification is that. Second classification includes your microtubule damaging drugs. the drugs that will damage the microtubule formation. So you know, for the cell division, microtubules are necessary. So if microtubules are damaged by the drug, then cell cannot undergo cell division. If cell cannot divide, so you can suppress the cancer. Okay, this is the mechanism. So second category is your microtubule damaging agents, or you can write agents or drug, anything you can write. Okay, microtubule damaging agents. You can remember this by a mnemonic MTV. MTV, you have seen this channel on your TV many times. MTV. MTV. M stands for your what? M stands for your microtubule. And T and V. T includes your which drug? Taxanes. Various taxanes comes under your microtubule damaging, and V include your two drug, that is your vincristine and your vinblastine. Okay, so taxanes, what is the examples come under microtubule damaging agents? So example of drug is that of your taxanes and your vincristine and vinblastine. Okay, so taxanes and vincristine, vinblastine are classified under your microtubule damaging agents. The mechanism of action is that these drugs will damage the microtubule formation. So if microtubule formation is damaged, then cell division cannot proceed. If cell then there is a arrest of cell division, so you can suppress the cancer. Mnemonic is that of MTV. M stands for microtubule. TV. T stands for your taxanes. V include two drugs, vincristine and vinblastine. Okay. Third category is that of your topoisomerase inhibitor. Okay. You remember, for the DNA replication, topoisomerase enzyme is needed. That is topoisomerase 1 and topoisomerase 2. So third is your that of topoisomerase. First is that of your type topoisomerase 1 inhibitor. Okay. So what drug are that inhibit your topoisomerase 1 enzyme? Topoisomerase 1 and 2 enzyme are included in your DNA replication. So when these inhibitor drugs, these drug will give, then they will inhibit both this enzyme topoisomerase 1 and your topoisomerase 2. And these two enzymes are required for your DNA replication. So what will happen? Your ultimately DNA replication will stop and cell division will stop. So act as a anti-cancer drug. So what drug include under topoisomerase 1? It includes your irinotecan. It includes your irinotecan. And second is your topotecan. So irinotecan and topotecan, both these drugs comes under your topoisomerase 1 inhibitor. Okay. Next is your topoisomerase. Fourth is your topoisomerase 2 inhibitor. Okay, 2 inhibitor. Topoisomerase 2 inhibitor. So topoisomerase 2 inhibitor drug is your etoposide. Okay. While you will write etopo, you will write take a term 2. Okay, alright, 2. So that means etoposide is what? Etoposide is your topoisomerase 2 inhibitor. Okay, and you can remember this topoisomerase 1 you one write Roman is like, you will write 1 like I. So the example is your irinotecan and topotecan. Alright, so by this trick you can easily remember. So topoisomerase 1 inhibitor is your irinotecan and topotecan, and your topoisomerase 2 inhibitor drug is your etoposide. Etopo is 2, so it is a topoisomerase 2 inhibitor. Okay. Next classification comes to your antibiotics. Various antibiotics act as your anti-cancer drug. Next is your antibiotics. So what drugs comes under antibiotics act as an anti-cancer drug? That includes your bleomycin, doxorubicin, daunorubicin, mitomycin C, actinomycin D. Okay, so these antibiotics act as the anti-cancer drug. That is your example. What are the example of your antibiotics which act as the anti-cancer? That is your bleomycin, doxorubicin, daunorubicin, mitomycin C, and your actinomycin D. Okay, so these antibiotics are classified as your anti-cancer drug. Next comes your platinum derivative. Next is your platinum derivative. Platinum derivative. Platinum derivative includes which drug? That is your cisplatin. Cisplatin. And one thing remember for this cisplatin is that it is the anti-cancer drug which is highly emetogenic. That means when the patient, those who are taking cisplatin, a frequent side effect complaining of your that was emesis. That's why while we will give this cisplatin, then along with that we just given some anti-emetic drugs also. So remember, cisplatin is the most emetogenic anti-cancer drug. Okay, so this question can be asked as MCQ. Most emetogenic anti-cancer drug. That is your cisplatin. That's why when you will prescribe cisplatin to any patient, you will give anti-emetic drug in combination also. Alright. Next is your, after that, some miscellaneous drug. Okay, some miscellaneous drug. Some miscellaneous drug are there which act as your anti-cancer. That is your hydroxyurea. Hydroxyurea, what action? It inhibit. What is the mechanism of action of your hydroxyurea? It inhibit your ribonucleic reductase enzyme. Ribonuclease reductase enzyme. Okay. Ribonucleotide. Sorry, it is a ribonucleotide. It is a ribonucleotide. So hydroxyurea is a drug which used as an anti-cancer. So what is the mechanism of action? It inhibits your enzyme ribonucleotide reductase enzyme, and this ribonucleotide reductase enzyme is also involved in your pyrimidine synthesis. While you will read your pyrimidine synthesis, there you will find. So ultimately pyrimidine synthesis is hampered, and because of that self division ultimately hampered, act as an anti-cancer. Remember, this hydroxyurea is also another use of it, that it is used for the treatment of your sickle cell anemia also. Okay. So hydroxyurea is also used for the treatment of your sickle cell anemia. Okay. And in there, this question is also asked as an MCQ. What is the mechanism of action of hydroxyurea? So it is your inhibitor of your ribonucleotide reductase enzyme. In this miscellaneous drug, second drug is your L-asparginase. L-asparginase inhibit your protein synthesis. Protein synthesis. So protein synthesis is inhibited. If protein synthesis is not there, then cell division will not there. So cell division arrest and it acts as a anti-cancer drug. Okay, so this is all about your anti-cancer drug, and it asks as a short note. So this is sufficient for your short note point of view, and never ever ask individually as a short note. Always combine with the LQ. So if question is asked, you must write all these classification and their mechanism of action. That is complete for your exam purpose. Okay, so thank you. That's all about for today.